guys, so this is going to be an update video because it's been an extremely long time since I've made one, and thank you to whoever mentioned that in my last video. Like, genuinely thanks, because I didn't realize so much time had passed since I made an update video. I don't even really remember what I talked about the last time I did an update video, so I'm just going to kind of talk about the last year and a half. But first, I have to mention, like, back before I was even diagnosed, the thing that got us, like, started on the path to Lyme disease was a test called CD57, and to my understanding, a very simplified explanation of what this test is basically like it tests the infection levels of your blood, and like below a certain number indicates a chronic infection. And so when I first had that test done, it was really extremely low, and so that kind of led my doctor to decide, let's test her for Lyme, and that's how I got my Lyme diagnosis. But this test has kind of been how we mark my progress, because after the first 6 months after I was diagnosed and I did the 6 months of antibiotics, my CD57 level went up, which was great, but I couldn't continue on with the antibiotics like I was doing, because although we had that jump in that number, my body just couldn't handle it and I couldn't do the antibiotics anymore. So then I spent the next 3 years without any movement in my CD57 level. No movement whatsoever. My numbers stayed exactly the same. And no matter what we tried, we could not get that number to move. Then about a year and a half ago, we started doing pretty frequent IV therapy, which was I would just go into my doctor's office, they'd hook me up to an IV, and I would get like a nutritional bag, and then at the end a glutathione push. I started doing that pretty frequently, but they're kind of expensive, so we couldn't get them as often as I really needed. But then I was blessed with this amazing neighbor who I've known my entire life, and she was really wanting to help me out in my health situation. So she has been helping us with financing my IV therapies, so I started getting them on a weekly basis. Also at this time, my doctor referred me to another doctor to see at the same time, and she kind of like took over my IV therapy along with some other things, and so I started getting weekly IVs with her, and she also tested me for some other things. She tested my heavy metal toxins. From that, we learned that I didn't have any like current exposure, but that I had a really high level of lead in my blood, accumulative. So like over time my body has just been storing lead, which apparently is really common with Lyme patients, and so that was important to know. And we also learned that I am like extremely deficient in a lot of my essential elements like sodium, potassium, phosphorus, calcium, magnesium, zinc, copper, sulfur, magnesium, boron, corium, lithium. Like all of them were deficient except for boron. That was the only one that wasn't deficient. So those are like minerals and everything. So along with the weekly nutritional IV that I was getting, we also added a minerals bag to my regimen. And now, let's see, this coming June, so next month, it'll be exactly 1 year since I've started like every single week going and getting these IVs. Now, a couple months ago, we tested my CD57 level again, and I saw an even bigger improvement than 3 years ago when I like first did the antibiotics. So it's slow and steady, but my CD57 level is increasing. It's slow, but it's increasing now that we've been doing these weekly IVs. Like, that has been the key for me, is getting these weekly IVs and like getting my body strengthened to fight the infection. It felt so good to like get my lab work back and see that the number had actually moved. Now, of course, the most important thing is how am I actually feeling? Because even if your numbers are getting better and you still feel like crap, like what good is that? And for a while, I was like kind of discouraged after like the first initial like, that's so great, my number is improving. Like after that kind of faded away, I was like, okay, my number is improving. Why am I not like feeling a ton better? Because I think overall, I am I am feeling a little bit better. But I definitely, I mean, day to day, I still feel sick in one way or another, you know, and I still have really bad days that just knock me out for the entire day. And I still have a really hard time leaving my house to do things, and walking around for 10 minutes at a time is enough to just leave me feeling so sick. But my doctor said, you know, like, your body has been fighting this infection for so long that their damage has been done, and it's gonna take a while to repair that damage once your body is strong enough to do, you know, once your body's strong enough to fight the infection off and then start like rebuilding and restoring and healing your body, you know, like, it's gonna take time. Even if the levels are good, it's still going to take time to get that healing going and to complete the healing. But we're headed in the right direction, and I really owe it to these weekly IVs, just, you know, getting my body the nutrition that it needs and essential elements that it needs. So that has been pretty much my past year and a half has been just weekly IVs and really staying on top of it and not missing any and just continuing on. That's pretty much it. That's pretty much all that's been going on the past year and a half, is just these weekly IVs. But it's been worth it because we're seeing improvement little by little, slow and steady, but we're seeing it, and so that's good news. And that's it. So thank you so much for watching and for taking an interest in my health to begin with, and I'll see you in my next video. Bye guys!